So coming to the pediatric anesthesia, the first important foremost question is what is the anatomical and physiological difference between the adult and the pediatric airway? Okay, it is a question of 5 marks. What is the anatomical and physiological differences between the pediatrics and adult airway? Coming to the anatomical differences between the pediatrics and adults. Neonates or infants and adults. Okay, relatively large size of the tongue. Relatively large size in the sense small mouth and large tongue in relation to the oropharynx. So in the relation to the oropharynx, they have a very large tongue. So the anesthesia significance is along here is difficult to put a supraglottic airway device, difficult to do the mass ventilation in the neonates or in the pediatrics age group because the relatively larger size of the tongue. In the adults, there is normal size of the tongue in comparison to the or in relative to the oropharynx. Large head. Here it is a relatively smaller head. Large head in the sense, again, it is very difficult to achieve the laryngoscopy view. The optimum amount of neck flexion and extension of the head we do, but due to the large head or due to the larger occiput, we're not able to get the adequate laryngoscopic view. Narrow nares. Not only the narrow nares, but also the nasal mucosa is very much fragile and very much sensitive. It will suddenly go to the spasms and it is very difficult to ventilate. So because of the narrow nares, mostly the pediatrics are obligate mouth breathers and henceforth whatever volumes of the gas we are delivering through the bag mask ventilations, because of the presence of narrow nares, most of the airs or most of the oxygens are not going to the airway. Here it is wider. Larynx is located higher, more cephalic. It is mostly in the C3, C4 regions, but it is in the lower C5, C6 region. So we require a straight blade like Miller's blade is used to do the laryngoscopy and do the intubations. So whenever we are doing laryngoscopy with the curved blade, due to the higher, because as the larynx is placed higher, it is very difficult to visualize the epiglottis and the trachea. Narrowish person is the cricoid cartilage. There are so many controversies about the narrowish person in the pediatrics, but most of the textbooks and most of the authenticated textbooks retains narrowish portion of the pediatric airway is again the cricoid cartilage. It is same as the adults. Okay. Again, the epiglottis is large, floppy, and more cephaloid. So it's the same thing. Again, here the Miller blades, the picture of the Miller blade comes to mind. As the epiglottis is very much large, it is floppy and is more cephaloid. It is very difficult to lift the epiglottis and put the tube inside the trachea. Here it is smaller. Non-ossified palate. So here also the palate is also non-ossified and maximum area of smooth mucosal like structures, smooth muscles like structures. So also the palate also undergo edema. The palate also very reactive to the laryngoscopy, and also there will be very much oral edema when we repeatedly do laryngoscopy in pediatrics. Here it is ossified. Okay. Tracheal length is very less. Around it is 5 to 6 centimeter. It is around 12 to 14 centimeter. Horizontal ribs and angulated ribs. Again, anatomical differences as the patient here the ribs are horizontal. The bucket handle movement is not possible, and also there will be lesser increase in the lungs, and the lungs becomes less compliant because of the placement of the horizontal ribs. Lesser number of alveoli, 20 to 50 million terminal air spaces. Here more than 300 million at the 18 months of age. So as because there's lesser number of alveoli, the lesser number of airway exchange, and the airway exchange is very much difficult in this patient. Okay, fine. So these are the important anatomical differences between the adults and the neonates or the child. Mostly they have all the things are narrows like narrow nares, and all the structures of the airways are made of soft tissues. So they are prone for obstruction, they are prone for spasm, and they are prone for allergic reactions, and they are prone for hypersensitive reactions.